Hey, it's Dr. Birchler with Life After Lyme Disease. Wanted to make a video regarding what to do when you actually have Lyme disease right now. The function of this page and this group will really be to deal with the things that come down the road after a person has Lyme disease. However, June and July is the peak months for having Lyme disease, and I've had a few patients in the last few weeks that have had new cases of this. And since that's happening right now, I think it's worth addressing really what to do immediately when you have it. So more of the immediate treatment as opposed to dealing with things down the road, getting your life back after going through that illness. So it's generally regarded that if you know you have Lyme disease, bullseye rash, that kind of thing, to do a course of antibiotics. I'm not really going to argue with that. I think there are different opinions. I think there are other options on that. When I had Lyme disease 3 years ago, I ended up taking antibiotics for it. Part of the problem is many people don't know they have it, they don't take it, and then by the time they figure out maybe that's what's going on, maybe they take antibiotics and it's not effective, or at times they actually end up worse for various reasons. So if you know that's the case, that certainly is the option. That's the standard medical type of approach, is to take antibiotics. Now for children and adults, the antibiotics might be different. Of course, you're going to work with some type of a doctor to prescribe those to get the correct one. What I would suggest here is that in our Western society, in the U.S., really they only use the pharmaceuticals for treatment. China has similar types of diseases, Lyme disease. They have research on that. China is an old country. They have traditional medicine, herbal medicine, and things that are still very much a part of that culture there. And they have, I've read things that suggest that combining herbs, like would be used traditionally, with the antibiotics actually gives a better outcome than the antibiotics alone. I would certainly recommend, if I was going through that right now and you had decided, well, we think that's what's going on, we want to do antibiotics for Lyme disease, I would do the herbal protocols with them as well. I think you get a better outcome. It'll help to strengthen the body, the immune system, minimize negative side effects and that kind of thing. There's a good book out there called Healing Lyme by Stephen Buhner. It has some of the common herbs to use for that. You can do searches for traditional Chinese medicine herbs, or talk to a practitioner who does that, and combine that in if you end up doing the antibiotic treatment. Another thing I want to mention is the nature of Lyme disease is many people don't know they have it. Part of the reason for that is you end up feeling sick, fever, that kind of things are common, but there might be no other initial signs that what you're dealing with is Lyme disease. It might just feel like you have a cold or the flu or something like that. Only about 30%, maybe 1 out of 3 people may get a rash, the classic bullseye rash that we associate with Lyme disease. So that's actually a minority of people will get this real classic thing that you or maybe the doctor would recognize as Lyme disease. So it's more of a clinical diagnosis, looking at what's going on with a person, time of year, some of these seasonal tendencies to figure out, hey, is that likely what's happening? So when it's the middle of summer and I see people getting like flu-like symptoms, especially this June and July when the new Lyme cases are very prevalent, I'm always a bit on alert to say, hey, is this just kind of a routine? This person has a cold or flu kind of thing, or do they have any other weird symptoms? Is there anything to me that indicates that this is worth investigating? So be aware for that for yourselves, for your family. If you have new people this time of year getting ill, especially if they don't seem to kind of bounce back quickly, or they have other odd things going on, something to be aware of, that it could be a Lyme or related illness this time of year as well. So I hope this helps. Thanks. Have a great day.